Hello, everybody. This is Allison with Safety Education Specialist, and I am here bringing you the latest 2020 American Heart Association guidelines. It is 5:24 p.m. on October 21st, 2020. That is launch day. So, let's hop in, shall we? This video is going to be for my BLS students. So if you're in healthcare, you take basic life support for healthcare provider, basic life support provider, basic life support renewal, heart code BLS, etc. This video is for you. If you are one of my Heartsaver students, please do not stay with this video. I'm going to try to figure out if I can put a link to the Heartsaver ones here and here. I'm anticipating two of those, one for CPR and AED, one for first aid. So if that is for you, please click here or here and move yourself to where you need to be. My BLS people, stay put. Let's have a little chat, shall we? All right. So first, one of my predictions was wrong. I will freely admit I was incorrect about this one. Some of my BLS folks know that I made the prediction that we would be doing a minute of continual compressions before throwing in some ventilations. But for non-EMS, guess what? You're still doing 30 and 2 when you're by yourself, or if you have a team on an adult victim, and you're still doing 30 and 2 when you're by yourself on a pediatric victim, or 15 and 2 for the pediatric victim. So that has not changed. Now, for my EMS providers, there is a little bit of a widget in there saying that yes, we can start doing some continual compressions and ventilations, etc., but that will be implemented department by department. That is not going to be something that's going to be in this course here. So let's go over the changes that were made. The first change, and this change I am excited about, I am happy about this, they have added a link to the chain of survival. So the new chain of survival has a sixth link, and that is recovery. So now Heart Association is starting to recognize that, hey, cardiac arrest and the effects that it has on victims and providers does not end with the rescue, doesn't end with resuscitation, doesn't end with ROSC. It keeps going for months and even years. So they are looking at not just what do you do in hospital as a best practices protocol to make sure that everything there goes well, but we're also looking at how to support the person afterwards, socially, mentally, physically, rehab, and things like that. So I'm really excited that they are putting that in there because post-incident care is very important. For those of you who know me personally, you know that this is something that I myself have been dealing with and have had to make some changes and some steps to accommodate. So I am very, very, very pleased that Heart Association has made that a part of their criteria. I'm very happy about that. They have also added a in-hospital cardiac arrest chain for pediatric patients. So they've added that in. We just used to say it's just the pediatric chain of survival. Now they're going to emphasize in-hospital arrest versus out-of-hospital arrest. So of course, when you come to your class, we'll be talking about that. Rescue breathing for the adult. This has been updated. I love it. It makes it so nice and simple. 1 breath every 6 seconds, about 10 breaths per minute. It was previously 1 breath every 5 to 6 seconds. We're cutting it and saying 1 breath every 6. So I want 10 good ventilations every minute if I'm doing rescue breathing on the adult. For my compressions, they have changed how we phrase things. And for my students, you've heard my class before, you've heard Fred's class before. You know we've been saying this for years, literally years. If you can't get the clothing out of the way right away, fine. Wait until the AED shows up and then use the scissors. No problem. But now they're actually specifying it. So I can only assume what was happening was people were not actually starting CPR right away. They were instead waiting to find some way to get rid of 10 layers of turtlenecks and undershirts before they started doing something. But AED, when the AED is there, we must be down to bare skin. So they have once again re-emphasized that and said you cannot ever apply AED pads over or under clothing. You've got to get the clothing out of the way. Very, very good. The next change, and my healthcare providers, you guys are going to love this. My number one question about infant CPR was always, why can't I do the 2 thumbs and circling hands technique on the infant when I'm by myself? Now you can. You have an option now. When you are by yourself doing compressions for the infant, you can do 2-finger technique, you can do 2 thumbs and circling hands technique, or you can even use the full heel of your hand. This one I'm going to caution you about because if you've got a really itsy bitsy baby, that one might not be the best idea, but If you've got an itsy bitsy baby, chances are the 2 thumbs is going to be just fine. So you're not going to have to worry about it. That is a wonderful thing, especially for those of us who have arthritis coming into the winter. I will tell you, I've been dreading having to do the 2-finger technique on the infant coming into wintertime, and now breathe a sigh of relief. We can now do the 2 thumbs and circling hands or a full heel if we wish. Love it. Very happy. Pediatric ventilation rates, that has also changed. So children and infants with a pulse receiving rescue breathing or CPR with an advanced airway, the numbers are the same. Okay, another improvement, 1 breath every 2 to 3 seconds. We're aiming for 20 to 30 breaths per minute. And the actual number you're going to do, whether it's the 2 or the 3 second, 20 to 30 per minute, is going to depend on the age of the patient and the clinical setting. So you're going to have to use your clinical judgment there, but you've got it. You can do it. No problem. Opioids, we do have a slight change to the algorithm. So I'm going to make myself a little bit smaller here, and we're going to pop into our opioids. So, suspected opioid poisoning. Responsive check, shout for help, activate EMS, get naloxone and an AED. Then you go down, you ask yourself your question, are they breathing normally? Yes. Prevent deterioration. Okay, keep your tap and shout. Keep the airway open. Do your head tilt, chin lift. Consider using naloxone, because if you know they've already taken an opioid and they're heading downhill, we want to prevent them from actually falling down that mountain. So consider giving naloxone even though they are breathing normally. And transport. Ongoing assessment here. So you are not going to leave this patient's side. You're not going to say, oh, they were fine 5 minutes ago. It's all good. You know, with opioids, situation changes really quickly. So reassess. Now, if they're not breathing normally, do they have a pulse? Okay, assess for less than 10 seconds. Yes, open the airway, reposition, rescue breathing or bag mask device, and give naloxone. No, start CPR. Use your AED, consider naloxone, and refer to your normal BLS cardiac arrest algorithm. Now, I'm going to suggest that you wait until you've done a couple of rounds of CPR so you've got some good perfusion, you've built up some good blood pressure, and then shoot the naloxone. Obviously, here we're talking about if you are going to be using naloxone with the nasal inhaler. If you have IV access, by all means, go ahead and knock that naloxone in there a little bit earlier if they do not have their pulse. All right, so we've done rescue breathing, we've done naloxone. Excellent, excellent, excellent. All right, make sure I get every single thing for you. This is all stuff that we get to change on our end, nothing you have to worry about. You won't even notice. Okay, all right, so for my BLS people, there is the gist of the changes. Now let's get into what really is making me happy. This is stuff that's not actual testing content. So everything I talked about so far is stuff that you're probably going to see in an exam, wink, wink, and stuff you're going to probably see in skills testing. Now let's talk about things that are going to start popping up in the course that are really important and that I'm very, very happy about. The number one thing that is coming out now that we're going to be talking about in BLS class, great change, what to do with a pregnant woman who's in cardiac arrest. That is now going to be something we talk about during class. I am very excited about that. Back in 2015, when that update came out, they started saying, hey, we've got to start paying attention to pregnant women because they're a little bit of a special case when we're dealing with cardiac arrest, because it's not 1 heartbeat, it's 2. Now, this is actually going to be part of our class. We're going to talk about it. We're going to go through what you do if there is a pregnant woman who is in cardiac arrest and how you treat that and what the algorithm is. Keep in mind that for in-hospital cardiac arrest for a woman who is pregnant, you're not going to be starting your fetal monitoring right away. You're going to be letting that go and focus on resuscitation efforts. And now, instead of having the 4-minute time clock that we used to have saying 4 minutes from onset of cardiac arrest, start preparing for delivery, now they've extended that to 5 minutes. So we are trying to keep the infant in utero for a bit longer if it's at all possible. But very, very happy. Now, if she does experience ROSC, always place her on her left side if she is pregnant. All right, very good. So that's the first thing that was changed. I'm so happy about that. The next thing is our debriefing for our providers after an arrest has happened, after we've had to work on somebody. What are we going to do? The debrief used to be just an analysis of what went right, what went wrong, how the patient did. Now, The debrief is going to include potential follow-up care for providers. As we know, and again, my students know because we've talked about this in the past, myself and Fred, um, dealing with your own emotions and feelings as a provider is very, very important. We lose a lot of medical professionals, way more than is acceptable, to PTSD and suicide. So I'm very happy that Heart Association has actually put in their guidelines that in that debriefing session, that providers should have made available to them professional help if they need it. So don't be afraid to say, hey, this is really messing with me. I'm not feeling good about it. This isn't working. I need some help. And believe me, we practice what we preach here. When we start to feel like something is overwhelming, we've taken on too much, we've had some personality changes or things that have been noted, we reach out for help as well. All professionals should be able to do that without any kind of stigma, without any kind of angst, and know that it's perfectly okay. It is okay to ask for help, and I am so proud the Heart Association has started doing that. And I will also put out there, again, my students know. Oh my goodness, I think this is my third update that I'm rolling with Heart Association on, and it's the fourth one I've experienced, but it's my third update as an instructor. The one in 2000, I was not an instructor yet, but oh my goodness, I was around for that and I saw some of the fallout. Here's what I will say. This rollout has been handled very, very well. I am very pleased with how Heart Association has handled it. I am very happy they have an in-science or an in-service science update for healthcare workers. Now, one word of caution, if you do take that course, it covers BLS, ACLS, and PALS. So if you're just a BLS provider, you are going to get a little bit extra that maybe you weren't counting on. There are some questions on that. Don't be afraid to take some notes. Let me just give you a hint. Dosages. Always know your dosages, but that's all ACLS. But just do that and you'll be fine. And yeah, Hart did a really good job with this, and I can tell that when they created the new course formats that we're going to be using, when they created the materials for instructors, that they really listened to instructor feedback. They listened to what we were, quite frankly, bitching about for a couple of years, and they did make a lot of positive changes. So, hey, props to the Heart Association. You did a good job this time, guys. So remember, the new guidelines are out. Your card is, of course, still good. The fundamentals are the same, 30 and 2, 15 and 2, same rate, same depth. All that stuff is the same. When you come in to see me for your next renewal or your full course or your heart code, I am going to let you in on some of the changes when they come in. I'm going to incorporate those in classes beginning now so that all my students are going to have that very, very soon. All right, so I will see you guys later. If you want to know what my Heartsaver students are up to, please feel free to check out the next two videos, one for CPR and AED, one for first aid. Remember, this is Heartsaver, so it's a slightly lower level, but hint, hint, we're still breathing in CPR. Super happy about that. All right, guys, so until next time, see you later.